Yes, hello beautiful people, and thanks so much for watching us here on Great Day Louisiana. I'm Malik Mingo as always. Boy, do we have a good show for you all. Tiana Taylor and Sherry Shepard are on the show today. Did you see my interview yesterday with Tyler Perry and Taraji P. Henson? It was a good one, and it's another star-studded hour coming your way, so get ready. First though, we're gonna begin with a health and wellness moment thanks to our partners over at Louisiana Blue. We love working with them. Now listen everybody, as you all know, legislative session still happening, and there are more federal changes that seem to be on the horizon, and that could affect Medicaid and healthcare.gov coverage. So we're having a conversation today about what you need to know and what you may need to do. Join me now is Mike Berteau, a healthcare economist from Louisiana Blue. Good to see you, Mike.
Great. Thank you.
Of course, thanks so much for coming on. I'm glad we're talking about this because, you know, so much information coming out every single day. And there are really two things I want to talk about first. Medicaid redetermination and cuts to eligibility. What can you tell us about that?
Well, we went through a pretty serious redetermination of Medicaid last year and the year before, and a lot of people were excluded from coverage. We didn't really see the uninsured in Louisiana jump up, so a lot of those people got coverage somewhere else. But people will still occasionally get a letter in the mail that says, you're no longer eligible for Medicaid. In that situation, my advice, reapply immediately.
Okay.
Because it's not unusual for the redetermination to happen to you because the paperwork's not complete. They may not have a current address or a phone number or an email address. So you want to get back, update all that stuff, and then reapply.
It's so important. So listen to that, everyone. If you've gotten that, what is a red slip, a pink slip?
Well, I think they're just regular letters now. But
regular letters, okay. They took out the colors.
Yeah, they used to be red.
And listen to him, it's so important. So if you have gotten a letter like that, make sure you first call to see do they have the right information.
Yes.
And if you are still eligible, they can re-enroll you. Now, another thing making headlines right now as well is talking about these potential changes to the ACA tax credit. I don't even know what that is.
Well, when you buy an insurance policy on healthcare.gov, there's an enormous amount of federal aid available to help you pay your premiums. And that aid really doesn't have an income cap. So even people who 10 years ago think, oh, I made too much money, they probably don't now. They could probably get the aid. But the current congressional authorization for that money expires in December.
Of this year.
Of this year. So in the fall, we know we're going to have a conversation about whether to extend those credits or not. That conversation is going to be held in Washington, D.C. And I will tell you, if you're reading my blog, straighttalkla.com, you will be right up to date with the latest changes as we go forward.
And that's good to know because, again, this all can change tomorrow, next week, but it's important that you all are aware of these potential changes. And at the end of the day, Mike, it's all about making sure you know about your options. You do not want to lose coverage. Tell us a little bit more about the options available.
Well, let me give you a quick scenario. Let's imagine that you're out doing whatever exercise you enjoy,
okay.
Running, walking.
Watching TV.
Watching TV is my favorite. And you go over to the kitchen to get another snack, but you slip and you fall.
Right.
And when you stand up, there's something wrong with your knee. It's just not working right. You go to the doctor, he does an MRI. Oh my goodness, you've torn your ACL. So now what you have to do is you have to have surgery, be in the hospital a day or two, and then have 6 months of pretty intense physical therapy to get back on your feet where you can run again. Right? My question to you today is, if you're not covered, what's that going to cost you?
A lot of money.
If you're writing a check, what's the number? And I did a survey among the docs up in Baton Rouge just to see what the cash price for all that would be.
Can I guess?
Go ahead.
$20,000.
Triple that.
You said triple 60?
Yeah.
My goodness.
So, right, we've all got 60 grand just laying in our checking account, waiting for the next time we fall down, right? No, nobody has that. So Medicaid, Medicare, private insurance through your employer, healthcare.gov, the VA, never let yourself go uncovered. Never.
It's so important, especially if you maybe did qualify for Medicaid, you lost coverage. Look to your employer to see what options are available.
Yes.
And if you don't maybe have an employment plan, look over to healthcare.gov, right? Because there is an affordable healthcare option.
Absolutely. And we try really hard to help people navigate. That website is not the most user-friendly, to be honest. So 844-GET-BLUE will put you in touch with an agent who's already done this, been there, done it 100 times, and they will steer you through this minefield, right? And they don't charge a penny. and you're not under any obligation to buy anything.
It's so important. So it's great to know that you all have agents available, because there can be a lot of jargon when it comes to picking your health care coverage,
So
and there's no
much.
obligation to buy if you work with Louisiana Blue. So that's good to know. But I want to talk about our 65-year-old people who maybe are watching this right now, or who may be about to be 65, like you, Mike Berto. Come on, Milestone.
Okay, look, I'm hosting an event at my home on the 21st for the guys I went to high school with,
Okay.
right, who are turning 65, and they're like, Medicare, Social Security, oh my goodness, I'm panicking. I'm like, so we're coming to my house, the remodeled house,
Yes.
right? Party house now. We're going to cook some steaks, and I've got a slideshow for them to tell them what they got, their options are
And
as
it's
we
so
go
important
forward.
that you're doing that for your friends, and you're going to share this with our audience as
Yes.
well. For people who want to know more information, what do they need to know? I was reading that you do maybe have to look at some type of Medicare, even if you are going to be working after 65.
Yep, if you're going to stay in the workforce as you turn 65, like I am, you need to consult immediately, if you're close, with your HR department at your company, because the type of plan they offer, the size of the company, all of these things can affect your obligations under Medicare. If you're not going to work, you've got 3 months before your birthday, the month of your birthday, and then 3 months after your 65th birthday to pick a plan and enroll. And even if you pick the wrong one, every year there's a period set aside from October to December where you can change plans, no harm, no foul. So it's just important that you get it started, that you get enrolled.
Well, your friends are going to learn a lot from you. And
Yeah,
next
they
time you
are.
come on the show, bring me a steak too, okay? Look, thanks so much for joining us, Mike. Great information as always. And if you all need more information about healthcare coverage and how Louisiana Blue can assist you, log on to lablue.com. All right, everybody, we're just getting started on the show today. We've got a four-legged friend and a human hanging out in our LCMC Health Wellness Lounge. Look at them. Oh my God, the North Shore Humane Society is here, and they're ready to share all the fun plans they have for the summer. Can't wait for that. Plus, we're learning more about a new documentary set to come out on Juneteenth, tomorrow. It's all about a man who tells the story of his life after his release from Angola. 21 years. Join us for that conversation after the break.